What was the care plan for your recipient?
Well, initially, it was a group of us. The family was all involved. But as time went on, I became the sole provider for her. The plan, there was really no plan because it was so new to us. We just took it, one day at a time, and just let the chips fall, and we took it like that.
I was the sole support. I was a born caregiver, and I know it's not easy for a lot of people. My plan was to make this whole transition as easy as possible for him, and it worked out beautifully.
As the sole support person or caregiver for my husband, there was only a backup plan in case I wasn't going to be available, so I really didn't have any other hands-on support person, although I did have a support person for me. So I was really blessed. Our transplant was unique in that he wound up having a 7-month hospital, or not 7-month, but 7-week hospital stay. And so it was really important for me that I had a caregiver for myself. I had a friend that just stayed with me the entire time because his health, after the transplant, we had a textbook transplant, but we did not have a textbook recovery. He had pneumonia. His new lungs got pneumonia right away as a result of him not waking up from the anesthesia. Then he got a bacterial infection from being in the hospital. Then he had DAD syndrome, which is a syndrome whereby the lungs are damaged because of the pneumonia. And then they thought he went into antibody rejection. So we had a prolonged hospital stay. And so at that time, I wasn't the caregiver, but I had a support person with me, which I would totally recommend for anybody whose loved one winds up having prolonged hospitalization. To face that alone by yourself day after day is just not, I could never have done it. But then, so after he was discharged 7 weeks after hospitalization, I was still the sole caregiver, but I had this friend of mine who, and he was discharged with a feeding tube, so all his meds had to be crushed. All 30 of his meds had to be crushed and mixed in liquid and pushed down a feeding tube. We jokingly called it the turkey baster because it's a giant syringe that after you crush the meds, you draw it up and you push it down their feeding tube. So nobody helped me do that. So grateful for the home care nurse that did come to the hotel room, though. So she would come and help me mix up some of the stuff that involves syringes. So in terms of hands-on support care or caregiver, I was it. After hospitalization, we had a lot of emotional and spiritual support from our church family, but our son wasn't even able to come and see us because he had the flu, like for 2 months straight, so he couldn't come and see us. So yeah, it was probably the most challenging time in my life, that season of his post-transplant. Now as his caregiver, he does really a lot more things by himself now. There's more things he can do for himself now. At least now he can put all his pills, he can count them out himself and fill up the cases and things like that.
I was the sole caregiver to Daryl. My plan was to take care of Daryl with any needs that he had and to especially take care of his medications.
Michelle's family consisted of, and support group consisted of her mom and her brother and myself mainly at first, and then kind of fell down to me from there after time.
My dad and I shared the caregiving responsibilities for my mom. So we were both there with her 24 hours a day for the first few weeks. And then after once we were released from the hospital and in an apartment in San Francisco, we traded off. So sometimes we were there the whole time on the weekends, for example, and during the week, on days he would go to work, I would stay, and on days when I went to work, he would stay. So that was our plan for caregiving, specifically related to who was going to be with my mom. We traded off, but we did a lot of it together as well.
I was a sole support person. The care plan for my wife basically was laid out by UCSF, and since she was a registered nurse, she was pretty much familiar with all the requirements of the care plan, and she supported me in being able to meet those requirements.
I was a sole support person. I did have backup support should I need it. That included friends and family. I did have a set of friends that came down for the training at the hospital, so I knew that they were good to go. I had others that could get easily trained and could step in, but I never did give up the support. I was always the one that was the sole support person. So, but I knew that I could call on them anytime.
I was the primary care support person. We had a backup plan, and my cousin Amy and my daughter Elise were the backup caregivers should I become sick.